Okay, I will call the meeting to order. First, let's start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Mr. Pratt, would you certify the agenda?
Good afternoon. The County Attorney's Office has reviewed all of the items on the agenda, and they meet legal compliance.
Excellent. Are there any member disclosures for any items on this agenda? I have none.
No, sir.
I have none, thank you.
I have none.
None.
Thank you. So let's move to the consent agenda. I hope everybody's had the opportunity to review the meeting minutes from our last meeting in April. If there are any revisions or any comments to it, I would take them now.
I do have one small spelling mistake on the first page under item B, attorney certification. Chris Pratt's first name is spelled wrong.
Yes, that is a misspelling. I'd like to amend the meeting minutes to reflect that it's CHRIS. And with that amendment, I would seek a motion to approve the meeting minutes.
Mr. Chair, I'll make a motion to approve the regular meeting minutes from April 14th, 2022.
Second.
I'll second.
All in favor, say aye.
Aye.
Opposed? Thank
Aye.
you. Thank you. Okay, let's move into the regular agenda. We have, starting with the Executive Director update. Director Hill, I will turn it over to you.
Okay, thank you. I'm going to try and synopsize again. I'm not going to read it to you. But I went and visited the CDPHE, good meetings with their environmental health staff. We toured the vital records area here in Castle Rock that Tri-County has built over the years, and we have taken possession of that area so we can start doing vital records there on June 1st. Let's see what else is interesting here. They're dealing with the state on lining up funding, so without my so much as asking, they sent me $853,000 to do core public health services, so that's an allocation that they make to all counties. It's not a grant that we applied for.
Can you explain, you say it's an allocation made to the county. So what is that, what's the source of that funding?
I believe it's state general fund money
Okay.
that they allocate for core public health services around the state and to the various health departments.
Is that like a pro rata share since we're in the middle of the fiscal year?
No, this is for the fiscal year beginning July 1, so that's a full state fiscal year for that funding.
Okay, so July 1 as of last year?
No, July 1. coming up.
So we'll get it July 1. I see. I thought you had it in hand. My apologies.
I have the paper in hand. I don't have the money until July 1st. And then we'll bill them quarterly for that amount, and we still need to take it to the commissioners to formally acknowledge we're accepting it. But I was told since it was an allocation, not a grant, that I didn't have to get permission to apply for it, and I didn't even get asked to apply for it. They just said, here it is.
Well, you're already paying dividends. People are handing you money.
Well, yeah, that's a good thing. And they did send me an application, a fast application for a grant from some CDC money for workforce training. So that's another $141,000 that we'll have coming in that I'll have to get the commissioners to give me approval in arrears to apply for, because it was like, here's the application, send it back to us. So I had to do it pretty quickly. But that's just going to help us with an epidemiologist, and it's going to offset part of the environmental supervisor's time to train staff. It's for developing workforce. So it seemed to fit pretty nicely, and I sent the application in, and 2 days later they sent me back that it was approved. So we'll have that to deal with. I still have something like $500,000 to $600,000 of money that I'm in conversations with them about. I don't have any paperwork or anything concrete to show you, but I believe there's another around $500,000 to come from the state still for the fiscal year. And then I'm trying to work on further clarifying what our fees are going to be, what our fee revenue is projected, so I can give you a, overall revenue picture for the health department. But I'm very confident we're not going to exceed the 2.5 million that's normally been going to Tri-County, and my goal is to actually reduce that call on the county general fund if I can. I'm not making that promise tonight, but it's something I'm going to strive toward. And we're still looking at facilities, both trying to make sure that we get left with our property when Tri-County vacates, and to figure out what we're going to do and who we're going to put where when we take over the 2 facilities that are currently used by Tri-County. And those are the major activities going on. We're getting all deputized by the state to issue vital records on June 1st, so we're all good to go, and everything is on track as far as I can tell.
Excellent. Are there any questions? Any comments?
Mike, I would just like to thank you for getting that vital records piece under control. I did not realize that Tri-County Health stopped that process here in Douglas County and made our citizens go up to their Willow address to get those documents. Having been the coroner, I understand how people need to get death certificates, and they need them in a timely fashion. So I really want to applaud you for getting that up and running June 1st, so our citizens have that convenience. And also, it's not just Douglas County records they're looking for, right? So if someone was born in Grand Junction and they need a birth certificate from Mesa, they can still come to our office here and get that.
Correct. Any county in Colorado.
And that's a great service. Thank you.
So you've covered vital records fees as well?
Well, yeah, there's not much to cover. The state sets the fees, so I'm just informing you these are the fees we're going to charge, and we have no choice but to charge those fees.
Right.
We can discuss it if we want, but there's not much to say about it.
The fees obviously cover the cost of service.
I believe they will more than cover the cost of services, so they'll cover a little bit of the cost of the supervision of the people doing the services.
Okay. Okay. So it's a cost neutral.
It should be cost neutral. I've got to, once we start doing business, really quantify it, but I don't see any reason it shouldn't cover its cost.
Okay. Thank you. We discussed the $853,000.
Correct. So that again is an allocation that's given to counties for core public health services.
Okay.
So that can fund, some of my time. It can fund some of the disease, the disease control stuff that we do when we have to investigate cases of different diseases, and any of the core public health services we can apply that money to, so it's not coming out of the general fund.
Okay.
Question about the funding. Well, do we know if how that was calculated? Do we have confidence that it was calculated correctly? I'm not trying to imply that anything malicious is being done, but we are new not only to ourselves, but we are new to the state. Is that a population based, Mike? Is it based on businesses? I know when we do allocations at Dr. Cog for transportation projects, it's a calculation of residents and employment, and that's how our allocation comes down through the federal system. Do we know how that's calculated, and then do we believe it to be a correct calculation?
Well, so I believe it's done based on population. And the people who sent me that task order are people I've been dealing with pretty closely in this process, and I do believe that they have our best interests at heart. I'll go back and review the formula and double check, but I have pretty good confidence that these people are on our side and want us to succeed, and that they've given us our fair share.
Okay, because I want to be clear, I am not financially successful to the point where I'm going to turn down $800,000. That still sounds really good to me. Again, I just emphasize we're new here, we are new to them. Probably just that double check, in addition to all your other tasks that you have before you, would probably be a prudent service to provide to the people of Douglas County.
Sure, I will do that.
That's a really good point, Commissioner, and sort of begs the question, when you I'm assuming you're going to be hiring a fiscal officer at some point, who'll be tracking all this and be able to do, more of that kind of analysis to make sure that there's no errors.
Yeah, and we have the fiscal person hired, and I've got him busy working on our WIC application right now, so they told me it's a simple application, but they want like tons and tons of data that I'm not sure where we'll find it, but it must be out there somewhere.
Well, it's simple for them. They hand it to you.
Exactly.
And it's difficult
Yeah. All
for
they
you.
had to do is click the email and send
Right.
it.
Are there any other comments? So the review approved proposed list of services for the health department. Now, we went over this in a work session, and we're approving it tonight. Well, I'll turn it over to you to sort of talk about, what we're going to do, what services we're looking at, and I don't know if you have if there's something you want to put on the screen or not, but I will turn it to you.
No, I mean, for anybody who's online watching, this is in the agenda packet. I didn't bother bringing a presentation on it. So what these are is my recommendations based on the discussions at the work sessions and the apparent consensus of the members who were at the work session. There's one item that I did change the recommendation on, the land use reviewing of applications. I was told to try and get community development to do that, but community development told me that they are required by law to send this to the local health department. And if the local health department doesn't act on it, then they have to send it to the state health department, and they opined that that would add considerable time to development activities. So I inserted this back in as a recommended service that we provide.
Okay.
So otherwise, I mean, the vital records we've talked about ad nauseum tonight. I stuck in a line about informatics and data reporting because we're going to hire someone specifically to make sure we have all the data that we get in our possession is going to be in some way viewable by the public on our website, so you can see everything that's going on. We're in the process right now working with the communication department to put our current financial status up there online where the public can look at it so they can understand that, no, this isn't going to cost more than it costs to have Tri-County, that, the $2.5 million is all I'm going to ask the county for. I consider that my funding ceiling, not a floor. So we're going to be a transparent health department. We're also recommending the emergency preparedness response and disease surveillance. Those are things we have to do. The federal government funds the preparedness activities. The communicable disease surveillance, part of that can come out of the core public health money that I mentioned, but we also have significant pandemic funds remaining for the next year to offset the cost of some of that function. So we're in good shape there. Those are important things for the community and just core to being a county health department. Then in the environmental part of our operation, we kind of trimmed the list of services from Tri-County down to retail food establishments, child care facilities, on-site wastewater, landfill inspections, body art facility inspections, stormwater reviews, solid and hazardous waste, and land use reviews, as I just talked about. So all of those, there was consensus at our meeting. They're all valuable to the community, and I think they're worth doing. And I'm going to cruise along. If you have questions, please stop me. Okay. All right. So I need to get closer to the microphone. Sorry about that, folks online. So under the Community Health Division of the Health Department, we're looking at the Child Fatality Review, which is required. It's not a big program. I think they reviewed 8 child fatalities last year, so I thought that myself, whoever I hire to run the Community Health Division, and our medical officer can handle that without having to add any extra staff for that. Child and Adolescent Health Program, we're going to include that in our contractual services once we see where that goes. We did get the proposals today. The period for proposals on that RFP ended today at 4 o'clock, so we'll know more soon about how that's going to go. Baby and Me tobacco-free was also considered for us to do, again, to be done by the contractor. Maternal, Child, and Adolescent Health Program, which is funded by federal Title V. We agree that we should do that, but we would encourage the vendor to apply for the Title V funding because it's a federal funding stream that can't really be subcontracted out to others. So if we took the funding, we'd have to do it ourselves. So I think it's better if the vendor applies on behalf of Douglas County to get Title V. The Perinatal Mental and Behavioral Health Program, there's not funding, it's not a high-cost program, and you know, the public outreach that was done before I got here indicated that there's a lot of interest in this health department doing more things for mental health and behavioral health in the community, so I thought that's an important thing to continue. Perinatal Substance Abuse Program, again, for similar reasons. You know, substance abuse and mental health get kind of entwined, so they're both important things to try and prevent in our community. Diabetes Education Program, we have a lot of issues with chronic diseases, including diabetes here, so I thought that's a good program to do. And, you know, if the contractor has put in their proposal to do it, then I'd suggest they perform it. But if the contractor isn't proposing it, I would think we could hire a person in-house to do that program because it is important for the health of our community. Let's see, mental and behavioral health promotion and suicide prevention. There are some state grants for that, which we would pass on to the contractor. And again, I think the contractor would do this, but it might be important enough that if the contractor won't do it, we might want to consider doing it in-house. And any of these things that I'm talking about, if the contractor doesn't do it, we might do it in-house. I would bring back to your board to make sure you're okay with that before I just hire staff. Substance abuse prevention, and I put in there including alcohol, because there are some issues with alcohol abuse and some drunk driving issues in our community. So I thought that was, again, consistent with the community's interests that they've expressed and important to our community. Injury prevention and senior fall prevention, that's something that wasn't on the Tri-County list of services that I added in. I think, again, it's important to the community as expressed in their community health assessment and their input on the FIP. Immunizations is an expected service of a health department, so we have to do that, but I'm assuming that our contractor will do that on our behalf. Sexual health, Medicaid should cover most of the clientele, and we would contract this out. Part of this is covered by federal Title X funding, and again, I would suggest that the vendor apply on behalf of Douglas County for that Title X funding, because if we apply for it, we would have to do the services ourselves. HIV prevention, again, there should be some insurance billing there and some state grants that cover that. It's not a huge problem in our community, but it is a problem that needs to be addressed. So I would, again, have the contractor do that. Healthcare for children with special needs. There's a maternal and child health block grant that might cover some of this, and I think since it's a block grant, it can be contracted out, is my understanding. So again, it's an important thing in the community. Shouldn't hit the general fund too hard, and I would have the contractor do this. The Supplemental Nutrition Program for Women, Infants, and Children, better known as WIC. That's the application I mentioned earlier that I have my finance person trying to fill out as we speak. I think that's an important one for our community. And by the way, I have agreed to partner with Elbert County to do a joint application for a WIC program for them as well, because they were covered by Tri-County. And they asked the other bigger counties if they would help them, and nobody said they would help. So I said, I thought we would be amenable to helping them on that. So that I think is going to have to be in-house staff, because it's not high clinical, so I don't need a lot of nurses to support it. I can contract with a registered dietitian and a WIC director in another county to just provide oversight.
Does administrative costs come out of what you receive in the grants? So
Well, that's what the grant covers, is the grant doesn't cover the actual WIC food that people go and buy. It's just for the.
Oh, it covers, that's what, okay, it covers the administrative. If you, really, my question was, if you did this for Albert, then you would receive their administrative,
Right.
okay.
Yeah, I'm not giving stuff away here. But I thought it was reasonable of them to ask for help, and nobody else responded, so I thought I'd try. And then advancing breastfeeding in Colorado, there might be some state funding. It's unclear to me so far. If we get a WIC program, it might be something we could tie in. Otherwise, it might be something the contractor has put in their RFP. I haven't actually opened the RFP. It's in my bag here, but I haven't opened it up yet. The nurse support program, this is a nurse or nurses that work in human services. So human services says they have the money to pay for them. So I said, if you have the money to pay for them, I'm happy to hire them, and they'll be housed at human services and do work on their behalf. Tobacco education and prevention. There are state grants. I've talked to that program, and they've told me it would be somewhere in the neighborhood of $200,000. So again, I would hope the contractor has bid to do that. If not, I think we could hire a couple of health educators ourselves and do it if we need to. And last is the breastfeeding peer counselors. This is one that's normally tied pretty tightly to the WIC program, but there are some guidelines on if your WIC program doesn't meet a certain size threshold, you don't get the extra money for the breastfeeding peer counselors. So I've got that down here as something we should do if the money comes forward to do it. So that was a lot of talking and me trying to face people in the room and talk to the microphone at the same time. So sorry if I didn't come through clearly online.
Thank you. Questions?
Not a question, Mike. I just want to thank you because Douglas County's secret sauce has always been about partnership and helping others and the synergy of that. I'm really tickled that you're going to help Elbert County. They're a small county. They are probably what Douglas County was 30 or 40 years ago. So by reaching out and helping them, and they have done a lot of good stuff for us. And at CCI, they've been fighting hard the collective bargaining bill that just got passed. So they're good people out there, so thank you for partnering with them. And Human Services has had a lot of success with their nurses program. They are finding that parents are taking their babies home and they have no idea how to take care of them because they were maybe single children or they didn't have other siblings around them at the time. So these nurses are going out and helping teach them how to take care of their babies. And there are a lot of statistics showing that it's helping kids not end up abused. So thank you.
And this list is my proposal to you that I'm looking for action on for you to approve.
Thanks.
Mr. President, unless, of course, there's additional discussion, if it pleases the board, move to approve the services list as presented by the Director of Public Health.
I'll look for a second, and then we'll ask for public comment, and we'll vote. Is there a second?
I will second.
Thank you.
I'll second it.
Oh, we have 2 seconds, which is great. So let's open it up for public comment. Is there anybody here in the room that would like to comment? Yes, sir. If you would just come up to the microphone and give the name and the town that you live in, we'd appreciate it.
Hi, hi. My name is Dan Steen. I live in Castle Rock. This is my first time coming to a board meeting. I'm really excited by what I hear here. It's great presentations. I have to confess an ulterior motive. I'm actually applying to work for Mr. Hill, and I just thought I should show up and find out what this thing's all about if I'm going to apply for a job there. So I wasn't actually expecting to say anything, but you asked, so I told you.
Well, thank you, and thank you for your interest in working for the county. We appreciate it. Troy, do we have anybody online who would like to comment?
Thank you, Mr. President. I have no online comment.
Thank you very much. Okay, so we have a motion, we have a second. I will call the question. All in favor, say aye.
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 Aye. Opposed? Wonderful. Okay, so let's move to the general citizen comment period. Is there anybody in the room who has a comment other than on the list of services? Troy, is there anybody online who has signed up to provide general public comment?
No, sir, I have no online comment.
Wonderful. Okay, with that, then, we have come to the end of our meeting. I would seek a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Aye.
Opposed? Great. Our meeting is adjourned. Thank you.